Well, CheckMate 816 is a landmark phase 3 randomized study that assessed neoadjuvant chemotherapy plus nivolumab, which is an immune checkpoint inhibitor, versus chemotherapy alone in patients with resectable non-small cell lung cancer. These patients are usually treated with surgery, which is a mainstay of the treatment. But we know that the risk of recurrence is really high. Historically, these patients receive adjuvant or neoadjuvant chemotherapy alone. In CheckMate 816, 358 patients with resectable non-small cell lung cancer, stage 1B to 3A, were randomized to receive either neoadjuvant treatment with chemotherapy alone, this is a control arm, or the same chemotherapy plus nivolumab, 3 cycles before going to surgery. And then they could receive adjuvant therapies depending on the findings and based on the investigator decision. We presented at ELCC 2023 the updated results from this study. The study is positive and achieved its primary endpoint of pathological complete response, 24% with nivolumab plus chemotherapy versus 2% with chemotherapy alone, as well as EFS, event-free survival, which was increased with the addition of nivolumab plus to chemotherapy. And this was previously published and in the New England Journal of Medicine. Here we have 1 year additional follow-up, and we are able to show updated EFS, updated overall survival, as well as some biomarker analysis and some subgroup analysis. And the first result is that with this 1 year additional follow-up, we still have durable benefit in terms of EFS in favor of nivolumab plus chemotherapy versus chemotherapy alone. The hazard ratio is 0.68. So we have a 32% decrease in the risk of disease progression or death after randomization. At 3 years, EFS rate is 43% with chemotherapy alone and 57% with nivolumab plus chemotherapy. Those are key findings to me that this benefit is observed across most key subgroups, including the subgroups based on surgical outcomes. We see this EFS benefit both in patients who had a thoracotomy, patients who had minimally invasive surgery. We see this benefit in patients who had a lobectomy, a pneumonectomy. So clearly, the benefit is observed across all the patient subgroups. We are also able to update overall survival. Still, overall survival is not mature enough at this pre-specified second interim analysis. Still, we have a tendency for an overall survival benefit. Median is not reached in either arm. At 3 years, we have an OS rate of 64% in the control arm, 78% in the nivolumab plus chemotherapy arm. This is a hazard ratio of 0.62. Still, not crossing the statistical boundary, but we will continue to follow this cohort of patients. We are also able to better understand the protective effect of the addition of nivolumab to chemotherapy in terms of risk of recurrence. And it was striking to see a clear difference in CNS recurrences, which actually were observed in 13% of patients who received chemotherapy alone as neoadjuvant treatment versus 4% in the nivolumab plus chemotherapy arm. So this is clearly a study that is continuing. The follow-up of patients is continuing. We will see overall survival data becoming more mature. And this is already a standard of care. The addition of nivolumab to chemotherapy is standard of care in the setting of resectable non-small cell lung cancer. It is approved in many countries. It is implemented in the routine practice. So clearly, this data further reinforce this option, nivolumab plus chemotherapy as the standard of care before surgical resection of non-small cell lung cancer.